Hi everyone, this is Dr. Stefan. Welcome to Interstitial Lung Disease.info. In this episode, I'd like to talk about what happens when people who have interstitial lung diseases or pulmonary fibrosis suddenly become a little bit more breathless than they used to be. And this could be over a period of days, months, weeks. It's something that's happening, but it's a little bit out of the usual decline that you would expect. So many people who have interstitial lung diseases, pulmonary fibrosis, idiopathic pulmonary fibrosis, etc., they have a slow trend of decline. So their lung function may slowly go down over the years. Now, when there's a bit of a drop, like a stepwise drop, we need to wonder whether there's something else going on that's not only the fibrosis. Now, first of all, with the caveat that there can be flare-ups or exacerbations of the pulmonary fibrosis, which are specific situations in which they are quite rare, but when they happen, they are very, very severe, and people who have pulmonary fibrosis end up in hospital. These are very rare occurrences, but they are very, very severe. So I'm not talking about exacerbations of pulmonary fibrosis in this video particularly, because that is honestly a whole different topic that we probably need to discuss some other time. But I'm talking about things that happen that maybe are not so severe. You don't end up in intensive care. You just suddenly become a little bit more unwell. Now, if it happens over a few days, most commonly there is a chest infection. This is what we see in practice most commonly. So I'm telling you the most common things. Now, obviously, there could be other things that may be happening in your case. So please discuss with your healthcare providers what the situation may be as it applies to your case. But in many situations, when we have a worsening in the breathing over a space of a few days, especially if they're associated with an increase or the change in the nature of your cough, with more phlegm, more mucus being produced, a different colored sputum, and more breathlessness, generally this could be the sign of a chest infection, whether it's just simple bronchitis or an episode of pneumonia. So this is something that you may want to tell your doctor about, maybe your family doctor, your GP, or another physician who's looking after your care, just in case there is something that you may need in terms of treatment, maybe antibiotics, maybe something like that. Now, if the breathing problem worsens over a period of weeks to months, now this could be a whole different story. There could be some other health problem happening. It could be that the fibrosis is suddenly getting worse, but generally this doesn't necessarily happen suddenly over a period of weeks and months. It could be in certain cases of interstitial lung diseases, especially the ones where we have an inflammatory component, so things like connective tissue disease associated interstitial lung disease or hypersensitivity pneumonitis. So these are specific conditions in which there's more inflammation in the lungs associated with the fibrosis. The inflammation can flare up a little bit. So there may be a flare up of the underlying rheumatological disease that's led to the fibrosis, or may have been a new exposure to something in the environment that's causing that's triggering the hypersensitivity pneumonitis. So this could lead to a bit more inflammation, or there may have been a change in your treatment. Maybe you've reduced the treatment doses a bit too soon. So in many situations, people who have interstitial lung diseases and are treated with corticosteroids or prednisolone treatment, things like that, they may have to wean their steroids down over time as part of the disease management process. And if we wean that dose a little bit too quickly, in some patients, there may be a little bit of worsening in the symptoms. So that's something that, again, you may need to discuss with your doctor. But that's only related to the fibrosis maybe getting worse, the inflammation in the lungs getting worse. But there could be other issues as well. If you think about people who have pulmonary fibrosis, in many situations, we're talking about a fairly elderly group of people. So maybe people who have interstitial lung diseases will have over 60 years old, 70 years old, 80 years old. So in this age group, you would expect that there may be some other medical problems happening. And this is really important to make sure that all the other conditions are being investigated and treated. So for example, someone who has cardiac disease, so maybe someone who suffers with heart failure. So when the heart's not really pumping well, if you suddenly become more breathless over the space of weeks and months, and maybe there's been a change in your cardiac medication, or maybe you're experiencing new chest pain, palpitations, maybe your legs have started to swell up a little bit, this could be a sign that there may be heart failure worsening, and this could lead to an increase in breathlessness due to a cardiac cause rather than the fibrosis getting worse. There may be also other issues that could be happening as well. So it's always good to know whether there's any other change to your health. Sometimes you can have anemia. So I've actually recently reviewed a patient in clinic who said that they were really, really breathless, but they had iron deficiency anemia. And once they received the appropriate iron treatments for their anemia, actually their breathing improved because their hemoglobin levels increased to normal, and then the breathing improved, even though they were suffering with pulmonary fibrosis. So this is really important to check. And this is something that your doctor may ask some blood tests for, just to check if this is a situation. There could be a lot of other reasons for breathlessness as well. So it's important to check. I'm just telling you common things. So we need to first rule out whether there's an infection going on, and this is something to do more with your symptoms and how you're feeling, whether there's anemia, whether there's cardiac conditions that may be coming up. So this could be atrial fibrillation that's newly diagnosed, heart failure that's worsening, or maybe someone who has a heart valve disease. For example, they have aortic stenosis and that's worsening a little bit. Or it could be, in rarer cases, that people may develop a little bit of a clot that goes into the lungs, and we call that a pulmonary embolism. This can happen also in patients who have pulmonary fibrosis and maybe they're not moving as much as they were before, or maybe there's another complication. There could be a lot of other things that may be happening. So I'm just kind of riffing off the top of my mind of potential causes that could happen that you could potentially be aware of. So some people who have pulmonary fibrosis may develop the collapsed lung. This is, again, rare within the rare of complications, but it can happen, and that may lead to pain in the chest and also breathlessness. There could be an effusion around the lungs that's compressing the lungs. This could be, again, due to heart failure or another potential cause, or it could be a complication of a chest infection, of pneumonia. There can be a lot of things that can be overlapping. So actually having good, regular follow-up with your doctor is really important if you're suffering with pulmonary fibrosis, just to make sure that there are no other comorbidities, as we call them, or associated conditions that potentially could have a treatment which could improve your outlook in the long run. So by all means, do check with your doctor if there's anything else that you need to be doing in your case. I cannot tell you on a case-by-case basis, but overall, these are some of the things I would look out for. And also, this is maybe an extra bonus for this video if you want to think about it in this way, do make sure that you are regularly having a check of your oxygen levels. This is something that your pulmonologist or your respiratory physician will arrange. It's just a check. Sometimes they may send you for a formal walk test or a formal oxygen assessment just to see whether your oxygen levels are dropping below normal levels, because that may suggest that you may need extra oxygen, and that can actually help you with your breathing and preventing some of these cardiac, especially complications, heart complications in the long run. But these are some of the things. And also, don't forget about pulmonary rehabilitation. I think it's something that you should probably mention in all the videos, I think, going forward. So pulmonary rehabilitation is basically formal exercise programs for the lungs. And these are generally run by physiotherapists. There are many versions and variations of this around the world, depending on where you live and what access you have to these sort of supportive care services. But pulmonary rehabilitation, just think of it as exercise for the lungs. And you should remember that even though you suffer with pulmonary fibrosis, you should still try to keep moving as much as possible, because it will probably help your breathing in the long run. It will help you cope better with any complication that may appear. So hopefully you found this helpful. It's just a little bit of a video that went a little bit all over the place, but hopefully it gives you some ideas of things to look out for if your breathing is suddenly getting worse. You know you're suffering with pulmonary fibrosis or interstitial lung disease, and you're not entirely sure whether that's related to the lung problem or maybe something else. And like I said, your doctor is the best person to ask which treatments, which investigations you may require in your case. Thank you very much for watching. All the best and good health.